تفضلي.
السلام عليكم. موضوع اليوم هو عن ال Subarachnoid cisterns with CSF and meninges. The objective is to learn about the subarachnoid cisterns, their locations and contents, the production, flow, and absorption of CSF, meninges, the dural enfoldings, the arterial supply of meninges, and finally the radiological aspect. Beginning with the subarachnoid cisterns, because both the brain and the internal contours of the skull have marked differences in shape, the subarachnoid space is not uniform over the surface of the brain, and there are spaces where this subarachnoid space is deep. These spaces are referred as the cisterns, and they contain cerebrospinal fluid. We have a number of cisterns which are named according to the nearby brain structures. Beginning with the cisterna magna, this cistern is located beneath the cerebellar hemispheres, and it is situated behind the medulla oblongata. It connects with the subarachnoid space surrounding the spinal cord, and it receives CSF from the fourth ventricle through its median aperture, which is also known as the foramen of Magendie. The contents, in its lateral part, it contains the vertebral artery and the posterior and inferior cerebellar artery. Once again, we can see the cisterna magna, which is situated below the cerebellar hemispheres. The next cistern is the pontine cistern, which is situated behind the clivus, and it is anterior to the pons. It is continuous with the interpendicular cistern above, and it receives CSF from the fourth ventricle through its two lateral apertures, which are known as the foramina of Luschka. It contains the basilar artery, which is formed by the union of the vertebral arteries, in addition to its labyrinthine and pontine branches. Once again, you can see in this mid-sagittal MRI, the pontine cistern situated anterior to the pons. And this in this axial section, we see it also in its location as it is anterior to the pons. So the fourth ventricle sends CSF backward to the cisterna magna through the foramen of Magendie, while anteriorly through the two foramina of Luschka, CSF flow from the fourth ventricle into the pontine cistern. The next cistern is the interpeduncular cistern, which is situated between the two cerebral peduncles. This cistern connects anterior to the suprasellar cistern, and posteriorly it is continuous with the ambient cistern. It contains three structures, two vessels and a nerve. The vessels are the posterior cerebellar arteries and the superior cerebellar arteries, which are branches of the basilar artery, and then the oculomotor nerve is located between them. Here we can see the location of the interpeduncular cistern, and anteriorly this cistern is continuous with the suprasellar cistern. Once again, this is the interpeduncular cistern. In this axial section, this is the interpeduncular cistern, anterior connected or continuous with the suprasellar cistern, and it is posterior continuous with the two ambient cisterns. The next cistern is the quadrigeminal cistern. It is situated posterior to the quadrigeminal plate of the midbrain, and it is located above the cerebellum and below the splenium of corpus callosum. It contains the great cerebral vein of Galen, which is formed from union of the internal cerebral vein and the basal vein of Rosenthal. Sometimes this cistern is referred as the cistern of the great vein. Here is the cistern, which is located below the corpus callosum and above the cerebellum. And this axial section, we can see it as it is situated behind the midbrain. The next cistern is the cistern of William interpositum. This cistern is situated between the two layers of the thalocoroida. The thalocoroida is invagination of the pia mater into the ventricles. We can see it as it is situated below the corpus callosum and the fornix and above the third ventricle. Once again, this is the cistern of the velum interpositum. This cistern, posteriorly, it is continuous with the quadrigeminal cistern, and it contains the internal cerebral veins. In cross-section, it is triangular in shape. The next cistern is the suprasellar cistern, which is situated above the pituitary fossa and below the anterior part of the floor of the third ventricle. The anterior part of this cistern sometimes is referred as the chiasmatic cistern. Posteriorly, it is connected to the interpeduncular cistern. Superiorly, it is continuous as the pericallosal cistern. Its contents are the optic chiasm and the anterior part of the circle of Willis. Laterally, this cistern is continuous with the Sylvian cistern, which is located at the Sylvian fissure. The pericallosal cistern. This is an extension of the suprasellar cistern, and it is continuous along the superior surface of the corpus callosum. Posteriorly, it is connected or continuous with the quadrigeminal cistern, and it contains the branch of the anterior cerebral artery. Here is the pericallosal cistern. The next cistern is the ambient cistern. This cistern is 2 in number. It is situated on both sides of the midbrain, and it extends between the interpeduncular cistern and the quadrigeminal cistern. We can see it as it is situated laterally on both sides of the midbrain, and it contains an artery and a vein. Namely, these are the posterior cerebral artery and the basal vein of Rosenthal. Recap سريع على السيستمز. Here's the cisterna magna, which is situated below the cerebellum. The pontine cistern, as it's located anterior to the pons, and it is continuous with the interpeduncular cistern. The interpeduncular cistern is continuous anteriorly with the suprasellar cistern. This is in turn extends superiorly and forms the pericallosal cistern, which is continuous above or along the length of the corpus callosum. The pericallosal cistern is continuous with the quadrigeminal cistern. Finally, the quadrigeminal cistern connects through the transverse fissure, which is a narrow slit, with the velum interpositum cistern. So far, any questions?
أكو أحد عنده سؤال دكتورة سولين حول السيستر؟ ماكو، تفضل.
Okay. The production, flow, and absorption of CSF. The total volume of CSF is around 150 cc, 25 cc of which is located within the subarachnoid space of the spinal cord. The CSF is formed by the choroid plexus, which is mainly by that of the lateral ventricles. Once CSF is produced, it will flow through the foramen of Monro, which is 2 in number, into the third ventricle. From the third ventricle through the aqueduct of Sylvis, it will pass into the fourth ventricle. This CSF, it will pass backward into the cisterna magna through the median aperture, while anteriorly it will pass to the pontine cistern through the 2 foramina of Luschka. A portion of this CSF fluid passes downward into the subarachnoid space surrounding the spinal cord, while the rest flows upward and diffuses over the surface of the cerebrum. CSF is mainly absorbed through 2 main pathways, one of which is the arachnoid villi. Now, the dura mater has holes in it, and the arachnoid mater, which is the second layer of the meninges, herniates through this dura into the dural venous spaces, venous sinuses are one. The arachnoid villi, they are most numerous along the superior sagittal sinus. So the CSF will flow into these arachnoid villi, and from these arachnoid villi, it will pass to the venous sinuses. The rest of the fluid, or 1/3 of the CSF fluid, will pass downward, and it will be absorbed by similar spinal villi, while the portion that remains, it will pass to the sheath surrounding the nerve, and from this sheath, it will pass to the surrounding perineural lymphatics. Okay, the meninges. There are 3 layers of meninges that cover the brain and the spinal cord. These are the dura, the arachnoid, and the pia mater. The dura consists of two layers, the outer layer, which is periosteum of the inner aspect of the skull, and it is continuous with the periosteum of the outer aspect of the skull through foramina and sutures. The inner layer, this layer enfolds and forms the dural enfolding. These two layers, they are usually in close contact with each other. However, they will separate in those areas where there's the venous sinuses and where the inner layer of the dura enfolds to form the dural enfoldings. The dural enfoldings, as I have mentioned, the inner layer of the dura falls inward and form what is known as the dural enfoldings. These are 4 in number. This is the falx cerebri. Below is the falx cerebelli. Then there is the tentorium cerebelli, and finally there is the diaphragma cella. The falx cerebri, in the median sagittal plane, it has a sickle shape. Anteriorly, it is attached to the crista galli, and it is continuous along the inner aspect of the skull, along the margins of the superior sagittal sinus. Posteriorly, it is broader, and it is attached to the tentorium cerebelli, and it encloses the straight sinus. Inferiorly, it has a free edge that lies in close contact with the corpus callosum, and the inferior sagittal sinus lies within its free edge. The next one is the diaphragma cella. This is a horizontal fold of dura. It almost completely covers the pituitary fossa. There is a small central hole through which the pituitary stalk passes upward. The next one is the tentorium cerebelli. This is a horizontal fold of dura which separates the cerebral hemispheres from the, it separates the occipital lobes from the superior surface of the cerebellum. It has an outer attached border and an inner free edge. The outer attached border is attached anterior to the posterior clinoid process. Laterally, it is attached to the petrous bone and encloses the superior sagittal, superior petrosal sinus. Posteriorly, it is attached to the occipital bone and to the internal occipital protuberance. The anterior free edge of it has no venous sinuses. It encloses the midbrain, and anteriorly it is attached to the anterior clinoid process. Here we can see on this axial section the tentorium cerebelli. The outer attached border of the tentorium cerebelli near the posterior clinoid process forms a recess around the trigeminal nerve and trigeminal ganglion. This recess contains CSF, and it is referred as the trigeminal cave or Michel's cave. Finally, the last dural enfolding is the falx cerebelli. It is attached from the internal occipital protuberance along the internal occipital crest to the posterior margin of foramen magnum, and it contains the occipital venous sinus. We can see in this X-ray there is falx cerebelli calcification in the midline. In this axial CT, we can see the normal falx cerebri, while there is falx cerebri calcification in this axial CT. Okay, in this axial CT, we see calcification of tentorium cerebelli. Okay, the arachnoid matter and the pia matter. The arachnoid matter is a delicate membrane which is impermeable to CSF except at arachnoid villi. It is separated from the dura mater by a thin layer of lymph and a potential space known as the subdural space, while it is separated from the pia mater by the subarachnoid space. The arachnoid matter projects into the interhemispheric fissure and the root of sylvian fissure, but does not dip into the sulci. While the pia mater, this is closely adherent to the brain surface and dips into all the sulci. The arachnoid matter, it surrounds the cranial and spinal nerves only as far as they exit from the skull and the vertebral canal, while the pia mater, it is continuous through the length of the cranial and spinal nerves, and it fuses with their epineurium. The pia mater invaginates with the choroid vessels into the ventricles, and the pia mater, along with the ependyma, form the choroida of the ventricle, which is a highly vascularized loose connective tissue. and it gives rise to the choroid plexus. Therefore, we can say that the pia mater contributes to formation of CSF, while the arachnoid matter, through the arachnoid villi, it contributes to absorption of CSF. So the pia mater contributes to its formation, while the arachnoid matter contributes to its absorption. A few clinical points. There are different types of intracranial hemorrhages, one of which is the epidural or extradural hemorrhage. The extradural hemorrhage occurs between the dura and the inner aspect of the skull. It happens in the setting of trauma, and the vessel that's most commonly injured is the middle meningeal artery. While the subdural hemorrhage, it occurs between the dura and the arachnoid mater. This occurs when there is insult to a bridging vein. The next one is the subarachnoid hemorrhage. This occurs due to rupture of an aneurysm. And in this type of hemorrhage, we can see blood accumulating in the subarachnoid spaces that I have mentioned in the first part of the lecture, or blood may accumulate within the fissure or within the sulci. The blood supply of the meninges. Most of the supratentorial blood, most of the supratentorial dura is supplied by the middle meningeal artery, which is a branch of the maxillary artery, while there is additional blood supply to the meninges that comes from the ophthalmic and anterior and posterior ethmoidal arteries, from the accessory meningeal artery, also the vertebral, the occipital, and ascending pharyngeal artery, they send meningeal branches. There are few procedures which are related to the cisterns, one of which is radionuclide cisternography. This is done to localize CSF leak and to evaluate hydrocephalus. In this procedure, a radionuclide is injected into the CSF via the lumbar root, and then pictures are taken over different or several time intervals to notice the spread of the radionuclide. Normally, radionuclide diffuses upward and starts to surround the basal cistern, the sylvian and the interhemispheric fissure, and finally, by 24-hour, activity should be seen surrounding the cerebral hemispheres. In children, this process is much more rapid, and activity can be seen surrounding the brain within 12 hours. Once again, this is a normal study where we can see the radionuclide as it diffuses upward, and by 24-hour, the radionuclide activity can be seen surrounding the brain. Another study is MRI CSF flow study. It uses cardiac-gated gradient echo phase contrast MRI to show CSF flow. This is used to show the direction and velocity of CSF and to demonstrate any abnormalities within the pathway of CSF. So we have magnitude and phase images. Before in magnitude images, before I play the video, in magnitude images, the CSF appears white, whether the flow is forward or backward. While in the phase image, if there's forward flow, it appears white. If there is backward flow, it appears black. So in this video, CSF flow is white, so we don't know if it is forward or backward. While in this one, because it is backward, it appears black. The next procedure is cervical myelography, in which a cisternal puncture is used to introduce contrast medium into the cisterna magna and the spinal subarachnoid spaces. A needle will be introduced above the level of C2, and it will be directed upward. The needle is not progressed more than 3 cm, and once it has failed to penetrate the atlanto-occipital membrane and it has entered the cisterna magna, contrast will be injected. However, this procedure has its own complications, as there might be injury to the spinal cord, the medulla oblongata, or vascular injuries might also occur. Cranial ultrasound. We can obtain images of the cisterna magna and the surrounding structure in infant by using the foramen magnum as our window. we can see this is the spinal cord. Anteriorly, there's the vertebra and the dura. Posteriorly, this is the occipital bone, the cisterna magna. And then there's the medulla oblongata, and superiorly, there's the bones. Any questions?
أكو أحد عنده سؤال؟ ماكو. نروح على الكويز. نارين.
نعم أستاذ. suprasellar cistern number 1.
نمبر 1 suprasellar cistern. لينا حسن.
نعم. number 2 pontine cistern.
أو سهولة بريبونتين بونتين cistern. مصطفى.
نعم أستاذ. نمبر 3 كافم فيلم انتربوستيوم.
أوكي. آيات.
نعم دكتور.
نمبر 4.
نمبر 4 quadrigeminal cistern.
inferior splenium. أوكي. رحيمة.
نعم
نمبر 5.
نعم دكتور موجودة. interpedicular cistern.
interpedicular. زين. محمد إبراهيم. نمبر 6.
نعم أستاذ cisterna magna.
cisterna magna. تفضل أستاذ محمد.
شكرا أستاذ رعد. غادة. A.
نعم أستاذ، هذا السوبراسيلر سيستم.
نعم. علي سمير. B.
نعم أستاذ، رايت سيربرال بدينكل.
نعم. صفاء عباس. C.
نعم أستاذ. interpedunculaire cistern.
نعم. شيريهان.
أستاذ. دي هو aqueduct of Sylvius.
وإي رسل نشمي.
cerebellar vermis.
شكرا.